Hey everybody, how you doing today? This is Adam with A-Game Health and Fitness. I hope you're having a good day so far. Right now we're going to talk about the 3 best tools for the lower back, hip, knee, and ankle injury prevention and pain management. The best tools and the best techniques so that if you do get an injury, what do you do about it? How do you get it back to action, back to your workouts? How do you get back to feeling better and being able to move better as quickly as possible? I'm sure a lot of you have been there before when you've been working out in the gym and oh man, you just tweak something, your lower back, your hip, your knee's hurting the next day, you're just not feeling right, you're not able to work out. It's very frustrating. I have been there too several times over the past 20 years of my working out experience. So I've been there. I've had back injuries, hip injuries, knee injuries, and ankle injuries, mostly muscular. And the good news is that all of it, most of it, if not all of it, can be prevented by regular routine maintenance using these 3 different tools that I'm about to show you. And I'm about to show you what are the best techniques and exercises you can do using these tools to prevent injuries and help manage your pain. Just to give you guys a little information about me, I have been in the fitness industry as a certified personal trainer and strength and conditioning specialist for the past 15 years. I have a master's degree in exercise physiology from James Madison University in Virginia. Go Dukes. So shout out, hey, where did you go to school? Where are you from? Do a little comment in the comment section. We'd love to hear where you're watching from, where you are from. And do me a favor, tag somebody that might benefit from this video. If you're watching on YouTube, go ahead and subscribe to my channel. I'm putting out a lot of more content. And if you're watching on Facebook, go ahead and give me a like, give me a share. Thank you very much. Now, we're going to get right into it here with the 3 best tools for lower back, hip, knee, and ankle injury prevention. The first one right here is the foam roller. Now, these have become more popular in recent years. You used to only see these in maybe a physical therapy office after you've had an injury, but now you see them in gyms, and go ahead and get one for your home. So we're going to get started right here with rolling out the glutes. So you want to sit on the roller on an angle. So sit right on that left glute, lean to your left hand's going to go behind you, and you're going to roll slowly back and forth over that left glute. If you can, you're going to put your right foot up on that right knee. That's going to stretch that glute muscle a little bit more. Then if you want even more stretch, you can pull up on your leg. So that's going to really allow you to get into that glute. And specifically, we're trying to target a little muscle called the piriformis muscle. You may have heard of that if you've had back injuries. You might be familiar with something called piriformis syndrome. You might also be familiar with sciatica or sciatic pain. And a lot of times, people mistake a lower back injury, an injury to the lumbar spine, as the cause of sciatic pain or sciatica, when in fact, the cause is often just your muscles are tight, the glutes are tight, and because the sciatic nerve goes through those glute muscles and down to your leg, the tight muscles can squeeze on that sciatic nerve, and that is what can cause that sciatic pain, numbness and tingling going down your leg. So before you go and set up to see an orthopedic surgeon, get yourself a foam roller and try doing all these exercises that you're about to learn. So we're going to switch sides here over to the right glute. All right, so you're going to lean to your right, and you're going to roll out that right glute. You're going to put your right ankle up on your left knee. The key here when you're rolling is to go slowly. That's going to help you to identify the painful areas. And once you've done that, when you find that spot that hurts, try to stay on it. roll over it over and over. One of the most common questions that I get asked is, how long should I foam roll? The answer is that it really depends on how painful or how tight that muscle is. If it's not painful at all, it's not tight at all, you can maybe just spend 10, 15 seconds on it. But if when you get on it, it's hurting, it feels tight, stay on that spot until you're getting some relief. So it could be a few minutes just on one spot. All right, so that is the glutes. Next up, we're going to get another muscle that gets very tight, often from just, if you spend a lot of time sitting, okay, it's the hip flexor, the TFL and the hip flexor, right there at the top of your quad, attaches right to the top of the pelvis. So imagine you're sitting like this all day. That muscle is just constantly in a short position. So one thing we can do to help with that is to roll it out. So we're going to lay face down on that roller with the right hip flexor on the roller. Throw that left leg out to the side. All right, and you're just going to roll right there just below the top of that right pelvis, up and down. And you want to make sure you get the front and the sides of your hip flexor. So you turn to the side a little bit, just to get into the side of it. Nice. That feels good. So foam rolling, the hip flexor, also stretching and lengthening and strengthening your hip flexors. Can all help with lower back pain and knee pain. Everything is connected. You might be thinking, well, my lower back hurts. Why would rolling out my hip flexor be helpful for my lower back? Everything's connected. So if you have tight and weak hip flexors, that's going to affect your pelvis, the way it's positioned, and that affects how the health of your lower back, your hips, your knees. So it's not just one area, it's not just one exercise that you need to do, it's all of them. We're going to switch over to the left side now. So laying on that left hip flexor, get that right leg out to the side, and start rolling back and forth. So I'm going to tell you a story, my personal experience with working out. I started my freshman year at James Madison. I started going to the gym every day, 2 hours a day. I wanted to get big and strong. Arnold Schwarzenegger was my idol. And so I was doing a lot of bodybuilding style workouts, a lot of powerlifting style workouts. And that was really it. I was not spending any time warming up. Definitely was never getting on a foam roller. And it didn't take too long of doing that style of workouts where I was just neglecting all these things. We're moving on if you can't tell, so just stay with me. We're going to hit the hamstrings next. So we're going to sit right on the roller, lift your body up and just roll up and back and down, up and down the back of the legs to get those hamstrings. So back to the story. So I'm deadlifting, I'm squatting, I'm not stretching, I'm not foam rolling, ended up injuring my lower back, my lumbar spine. And so had to really take several steps backwards, started doing physical therapy, massage, even got into Pilates, which is amazing for strengthening your core. That's another topic we'll go into another day, is core strength and how that's helpful for lower back injury. But so through that, a year or two of totally changing the training routine I was doing allowed me to heal from that injury. That was a long time where I could not do the things I enjoyed doing. So now we're going to cross your left leg over your right leg so we can put a little more pressure into that hamstring. We're going to switch right leg over to the left so we get some more pressure into that left hamstring. The hamstring is a very important muscle to strengthen and to stretch. If you have tight and weak hamstrings, that is very strongly correlated with lower back pain and knee pain. So really need to take the time to strengthen these muscles as well. All right, we're done with the hamstrings. We're going to move on to the calves. Okay. So we're going to start with the upper calf muscle, the gastrocnemius. Okay, that's the muscle most often associated with calves when you think about the calves. And those can get very tight if you're doing a lot of impact-related exercises, if you're doing a lot of running, sprinting, jumping. Really need to make sure that you're putting some time into rolling out your calves. Okay, and just like the hamstrings, we can get a little more pressure into it. Put one leg on top of the other, and you do get a little upper body workout here. If you're doing this with me, you can tell just holding yourself up is a good workout. You go rolling back and forth, getting the right side. Now you can even roll your legs side to side. All right, now we're going to get to the lower calves, the soleus. This is the muscle that sits underneath the gastrocnemius. You're going to strengthen it by doing the seated calf press. So we want to roll out those muscles as well. So we've gotten the back of the legs. We need to now get the side. So this is the IT band. Now this one is pretty intense. If you're not used to it, you're going to begin by placing your bottom leg on that roller. You're going to get your top leg out in front of you and keeping that bottom leg straight, rolling up and down slowly on the outside of that bottom leg. That is your IT band, folks. And that muscle, that iliotibial band, a very dense connective tissue that runs up and down the entire side of your leg pretty much, can get very tight. And when it does, it can affect your knee. It can affect your hips. So need to do this one for sure. I remember the first time I did it, it feels like you're being stabbed in the leg. But then before long, if you're doing it regularly, it's going to start feeling better. It's not going to hurt as much. It's going to feel good. I promise you. You might not believe me, but if you stick with it, you'll see. All right, we're getting that IT band. Again, going slow, going all the way down to the knee. We want to go all the way up to the hip. Good, we're going to switch sides. Hope everybody's doing good so far. If you just joined in, go ahead and comment where you're watching from. There we go, getting the other IT band. We need to make sure we get both sides. Start with the one leg out in front, that top leg. And then if you can, put that top leg right on top of that bottom leg. That's very intense, so if it's too painful, just go back to having the top leg in front. We're rolling out our IT bands here. You're watching the 3 best lower back, hip, knee, ankle, and pain management and injury prevention tools and techniques right here. There you go. We just finished our IT bands. Now we're going to move on to the shins. So place that side of your lower leg right on top of that foam roller. Get the top leg up on top. Lift yourself up and roll up and down the shins there, the side. This is going to help if you get shin splints, if you're a runner, or do a lot of jumping or high impact exercises. There you go, just a little bit every day. Now, you do not need to do all of these exercises every time you foam roll. You can just take the ones that you find to be the most effective for you and what you need. But I do recommend spending about 5 minutes before you start working out, doing some foam rolling. That is part of the workout. There you go, guys. Good job. Rolling out those shins. Good. Now, so we've got in the back, we've got in the front of the hips. Time to get the quads. So we're going to lay face down right on that roller. And we're going to roll your way up the front of the thighs, the quads. Now, definitely pay attention to where you're feeling that tightness. You want to make sure you get down just above the knees. Really focus on that area as well. Then go to the middle of the thighs. And then up towards the top. Again, nice and slow breathing. Hey, if you haven't done it yet, go ahead and like this video, subscribe to the YouTube channel, share it. Tag a friend that you think might benefit from watching these exercises. This is Adam with A Game Health and Fitness. My mission is to help you, to help motivate you, to inspire you, to educate you, to improve every aspect of your health and your fitness. That is my mission. So I'm going to be providing videos that are going to educate you and motivate you to be more active on a regular basis, to eat healthy. So keep checking out, check this YouTube channel, check this Facebook page. If you haven't done it yet, go ahead and go to that A Game Health and Fitness page and like it so you'll get notifications about when I'm going live. All right, so that is our foam roller for the quads. Oh, we got one more spot to do. This is tough to get. We're going to get the inside of the quad. So to do that, you're going to lay on that right side. Kick your left leg out to the side. Put that roller right under the quad, just on the inside of that quad. Lift your body up, and then you're going to roll out the inside of that quad. Now that's definitely a tight spot for me. Nice and slow, all the way up, all the way down. Now if you get into a spot that is very painful, breathe through it and keep moving. Do not hold your breath. There you go. Now, so you're getting all this right now. You can do this for free at home. These are great ways to prevent injuries, to treat any injuries, so you can get back to working out and back to feeling better quickly. All right, we're going to switch sides here. So laying on your left side, throwing that right leg on top of the roller, rolling back and forth. Go ahead, comment. How many of you have had a back injury? What happened? What were you doing? Were you just trying to pick up the newspaper? Were you lifting? Or did it steadily, get worse over time? Elephants don't bite. It's not often, it's much more often that we get injuries that develop little by little over time because we're not doing the right things on a daily basis. We're skipping over our warm-ups. We're not foam rolling. We're not stretching. We're not doing any cardio to get the muscles warmed up. And then a little annoying ache or pain turns into an injury. All right, so that is the foam roller. All right, that's our first tool for pain management and injury prevention for the lower body. So now we're going to move on here. We're going to use a lacrosse ball. That's right. So if you don't have one of these, go ahead and get yourself one, a little lacrosse ball. And all you're going to do, all right, is put one foot on it and just roll back and forth over that lacrosse ball. Here we go. And you can control how much pressure you're putting into that. And this is going to be very helpful for plantar fasciitis. If you are a runner, especially, this is something that you want to be doing on a regular basis. Okay? If you do a lot of jumping in your training program, or if your feet just hurt after a long day at work, you don't need to use a lacrosse ball. You can just put a can of soup under your foot and roll your foot across that. So we're going to switch feet here. Oh yeah, that feels great. It does hurt, especially the more pressure you put into it. It hurts, but you got to take care of your feet too. You could have a back pain in your back coming all the way from your foot. Okay, so that's why we need to address everything. The area you're feeling the pain in, that's just a symptom of the problem. We need to get to the root of the problem, and it could be coming from another side of the body. It could be coming from an imbalance in the upper body that is causing a lower body malfunction. So it's good to address everything. All right, so that is how we use our lacrosse ball for the lower body. And our last tool here this thing I love. This is a little more technological, all right? It is not a stability ball. Okay, here we go. Hypervolt. Now, if you get yourself one of these bad boys, you're going to be loving it. You will not be regretting it whatsoever. A lot of my clients have actually purchased one of these and use it every day, okay? It comes with some different attachments. You just twist, pop it off, put your different attachment on. Now, let me show you how to get this started here. So let's say we're turned off, all right? We need to turn it on right there. Then we're gonna hit our power button, all right? Then it needs to calibrate. So you're gonna keep your eye on those 3 white dots. When it flashes 1, 2, 3 in sequence, that means it is ready to go. So you need to wait for it. There it is. Right here's your control for the intensity, all right? So you can see we're moving here. All right, if you click that one time, level 2, it's gonna get going a little faster. And level 3, if you really wanna get in there, gets going even faster. So I would start at level 1. Okay, we're on level 1 here. So the reason that this is probably my favorite tool as a pain management, it's easy. You don't really need to do much at all. You can do this while you're watching TV and you're just sitting there and you're giving yourself a nice massage. You can go all the way up and down the muscle. The one tip, when you're doing this, you do not want to go over the bone. You want to stick to the muscle. You can get the side of the IT band there. Very good. We're going to get a little more intensity here. We're going to go up to level 2. All right? And you are in control. All right? I would not recommend doing this on someone. Let them do it on themselves. Unless you are a trained professional, you really should not be doing this on somebody else, okay? You can injure somebody if you're using this incorrectly. It's so easy. It feels great. Like you're going to put this on yourself for 5 seconds and be like, I got to get one. So this is the Hypervolt by Hyper Ice. It's a great tool. I did do a little research and review of some different personal massage devices, and for the price, you're really getting a lot with this one. It's quiet. You may have heard some other personal massage devices that are just so loud and obnoxious that you want to turn it off the second that you turn it on. So, this is a nice quiet one, very easy to use. All right, we can't forget, we got to get the glutes as well. So you can really dig right in there. There you go, guys. Good. Get it. Make sure you get into the hip flexors. You can even get the bottom of your foot. There you go. Now, my feet are ticklish, and this isn't even bothering me if you're worried about your feet getting ticklish. But get the bottom of the foot. Make sure you're getting your shins, and you can see those vibrations right there. And you do this for a few minutes a day. It doesn't take much to do it, and you're gonna go a long way towards preventing injuries. And that is really what we want to try to do. If we can prevent an injury in the first place, we are much better off. Versus if you get an injury and then you have to try to treat it. There was a chiropractor that I've worked with, Dr. Jabu Williams, when I was at Lifetime, and he told me that once you've gotten an injury, you are 80% more likely to re-injure that area. So injury prevention is, it's not a surprise that injury prevention is the way to go. It kind of goes along with trying to prevent chronic conditions like heart disease, diabetes, cancer, and other chronic autoimmune diseases. Most of the cases are preventable if we eat right, if we exercise regularly, and if we're healthy. So thank you for watching. What I want you to do right now, okay, do me a favor and subscribe to my YouTube channel. Like if you're watching on Facebook. Comment where you watch this video from. Tag somebody that you think would benefit from this video. And go ahead and ask me a question. Go ahead and make a comment what would you like to see me cover in the future? What are some topics you want me to talk about? I would love to, get your input and give you some information that is relevant and educational, maybe a little bit entertaining, I hope. But thank you so much for watching. The last thing I want to say is a little reminder for you to just try to be healthy. It's not what you're doing in that 1 hour that you're working out in the gym or in that half an hour. It's what you're doing the other 23 hours of the day. So make sure you're eating healthy. You're getting plenty of fruits and vegetables. You're trying to minimize your processed animal products or eliminate it. Okay? That's another topic of conversation for another day. Drinking plenty of water, getting rest. We break our muscles down when we work out, so we need to let them recover and to heal. And they do that when we are resting, when we're sleeping, and by giving them the proper environment to heal and grow in. And we give them the proper environment by eating right and resting and drinking plenty of water. So one last thing before we go, I just want to remind you to bring your A game. All right, guys. Have a great day. Thank you again. Take care.